Hi, I'd like to introduce you to the medical laboratory and what it's like to be a medtech. I'll first introduce myself. My name is Dustin Fawcett. Those letters after my name just mean that I passed a certification exam. We'll talk about that later. I work as a lab supervisor at Revere Health and have been for the last 6 years. And as such, I've trained a lot. And so I have some experience in the medical laboratory field that we'll be talking about today. So let's jump into it. The reason why you're here. Um, Move myself out of the way. So, what is the medical laboratory? So, let's say a patient goes and sees a doctor, and the doctor wants to know more about the patient's cholesterol. Well, the doctor can't know that just by looking at the patient. And so the doctor writes an order and sends it down to the laboratory and tells the patient, hey, you need to go to the laboratory and get your blood drawn. And so the patient goes down to the laboratory and meets with the phlebotomist. The phlebotomist will draw the patient's blood and store it in tubes, right? The tubes then get sent to the laboratory, okay? And this is after the patient is gone. So now the tubes are in the lab. The lab, the medical technologists in the lab will take those tubes and put them on analyzers or machines. And this is kind of what it looks like. So the medical technologist here has put a bunch of tubes onto one rack and is placing that onto the analyzer so that the analyzer can test the blood. And at the end of the test, the analyzer will be able to spit out a result for a cholesterol, for example. Over here on the right, same kind of thing. Different tube, so a different test will be run on this one. And same thing, we'll put it on a rack, put it on a machine, and the machine will test it. So once the machine is done testing it, like I mentioned before, it'll produce a result, and the result gets sent to the doctor. Now, before it goes to the doctor, the medical technologist here will review the results for quality to make sure that the results reflect what the patient is actually producing. Okay. Um, this is done through quality assurance and a few other things. We won't dive into that part yet. But let's just say that the medical technologist reviews the patient's results, and if everything looks good, we'll send it on to the doctor. And the doctor will review the results and will diagnose and treat depending on those results. Okay, so tubes come to the lab, they're tested on an analyzer, and the results are sent to the doctor. That, very simplified, is what the medical laboratory is. Now, why is it so important? Well, when a doctor is diagnosing a patient, 70% of the information the doctor uses comes from laboratory results. And if you look at a patient's chart, typically about 70% will be laboratory results. And so this is where the medical laboratory plays a very key role in the health of a patient, even though a lot of people don't even know what the medical laboratory is. So, what is a medical laboratory technologist? This is the person in the lab testing the samples on the machines or kits or however the test is done. That's this person's job. So, I've only scratched a little bit of what the medical laboratory technologist does. And if you're interested in this position, I highly recommend you visit even both of these websites, but both of them do have overlapping information. The top one, Lab Techify, what do medtechs do? That's where this QR code will send you. And Coursera, medical technologist. Let's jump into this one real quick because they did something interesting here. Uh, they took a local hospital's job posting for a medical technologist and broke it down line by line. So this top one performs routine and stat laboratory testing. They broke it down to performs laboratory testing and broke it down into layman's terms here so it's easier to understand. And there's quite a lot of information in there. Took the second job requirement and broke it down into segments as well. So there's a lot of great information there. And then under that, a typical day for the medical technologist may look like this, and then outlines a day in the life of a tech. Of course, this isn't comprehensive. There's a lot of details missing. but it does give a lot of good information there. Anyway, let's jump back into this. All right, current stats in medtech. So this top section shows the median pay for 2022. We'll get into pay in a minute. What I wanted to focus on down here are the bottom three lines. And this is an image taken from the BLS website, but this talks about job outlook, which I think is really important when you're trying to determine a career and what the outlook is. So the number of jobs in 2022, you'll see 342,000. Job outlook for the next 10 years is a 5% increase faster than average. So the outlook is looking pretty good already. And then when you account for the baby boomers that are retiring, and there are some med techs that have been in there forever, they're retiring, leaving positions open, plus an increase of that 16,800 jobs. It's been said that it's a bit of a crisis trying to find qualified med techs to fill positions. And so the job outlook is great for medical technology. Again, if you want to check out this image as well as some more information, you can check out this link at the bottom, the BLS website. It's really good. Financials of medtech. So I mentioned that we're going to talk about it. I'm from Utah, and so I have access to Utah numbers for different jobs. And so we'll jump into those numbers. But pay is always very regional. So research what the jobs in your area are paying before you commit to a career in that path. It's maybe important. Okay. So medical assistant, I'm going to start off with a few jobs that are very common in the medical field that a lot of people will get trying to get into medicine or just trying to see if this is for them. Medical assistant is a certificate training job, so doesn't require a bachelor's degree at all. Starting pay 15.41 per hour, and just multiplying that by 40 hours a week, and then timesing that by 52 weeks a year, we're looking at $32,000 a year. So I'm going to keep track of that over here on the right side, the annual pay, and we're going to compare a few other jobs. Okay. The note here does not increase with bachelor's degree. So if you're working as a medical assistant through college and then you graduate, you're likely to not get a pay increase after you graduate. There's just no need. And so we'll move on to the next one here. Medical scribe, very similar in pay to the medical assistant. Very different job, but pay is about the same. And again, does not increase with a bachelor's degree. So we'll put it over here on the right with an increase of $291 per year. Again, it's about the same. Phlebotomist, you will see an increase here. They do make a bit more money. Certificate training. There's a note here, and I think this is important to bring up. Certificate training is recommended and not required in Utah. You'll have to look at your state's regulations, but Utah does not require a certificate for that. However, every place that I've worked at with phlebotomists, they do require a certificate. They just don't want to deal with training completely from the beginning how to become a phlebotomist. So it's not impossible to get a job. It is very difficult to. So it is highly recommended to get a certificate. Anyway, moving on. Starting pay 17.51 an hour translates to $36,000 a year, which looks at about $4,000 increase over a year, and it does not increase with a bachelor's degree either. Okay, so this is where we start getting into the medical laboratory. So a lab tech assistant is typically a high school equivalent education level who has gotten a certificate, again, recommended, not required in Utah, but starting pay is a little bit higher than a phlebotomist, which translates to about $38,563 per year. And that is an increase of $2,000 over the phlebotomist and about 6,500 over a medical assistant. So it's a good pay increase, understanding that this is still just a high school equivalent education level. Now, at the bottom here, it does say does increase with bachelor's degree. This is why I wanted to bring this up. So if you were to become a lab tech assistant through college, and then once you graduate from college, you would get an increase in pay. And it looks like this. The medical laboratory technician with a bachelor's degree, again, a certificate training is recommended but not required. Pay per year bumps to $52,582 per year. Okay. So over the lab tech assistant, that's an increase of $14,000. And over the medical assistant, you're looking at an increase of $20,000 a year. Now, these are starting pays, and whatever you're doing for work right now probably is not a starting pay. Maybe you've been working there for a little bit and have gotten an increase. So let's jump over here. Lab Techify actually created a salary calculator based on these numbers that I pulled, and this QR code will send you there if you want to check it out yourself. But I'm going to jump over there just to kind of show you what it looks like. So it defaults to this. But let's say you're working and have been working as a medical assistant for a while, and now you're making 16.50 an hour. You do have a high school education level, but you're graduating from college. So let's see what you would make with a bachelor's degree. So that translates to an increase of about almost $9 more per hour. And over the next 12 months, that's an increase of $18,000 a year. And this, if you punch in your hourly earnings here, this will calculate what you can kind of expect to earn. Of course, this is just for exploratory purposes, but it does give you kind of an idea of what to expect. Now, this bottom part here, Lab Techify is a training program, so they do have different options to pay for it. The most expensive one is this no risk to you. And so if you were, and so this number here is what you would make after a year once the program is paid off. Other programs, there's a few others out there you can look around. They're going to be similar in pay, some more, some less. Do your research. Um, but this gives a good idea of what you're looking at in the long run. Okay, let's jump back into it. So, how do you become a med tech? About 75% of med techs that I've worked around, and the number may not be accurate, but about 75% that I've seen get a 4 years bachelor's degree in medical laboratory science. And then they complete a 6 month internship, and then they can sit down for this ASCP certification exam. That's what I did. It's a great way to go if you know that the laboratory is where you want to go before you start college. Um, it's also recommended, and some hospitals and laboratories require it if you want to become a laboratory director and advance in the ranks in that world there. If you're just looking to get a job there, a 2 year associate's degree is a great way to go. You can still work in the medical laboratory. You won't get paid the same amount, obviously, but it's a great way in. And then if you have a bachelor's degree in the life sciences, I would highly recommend having a bachelor's degree just because the pay is so much more. But certificate training is a great way to get into the medical laboratory, especially as there's a bit of a crisis and the job outlook is great right now. This is a great way to go. So, is the medical laboratory right for me? Let me get out of the way of that one. That QR code will send you to this link, Lab Techify. There's an assessment on the page. We'll go there in a second. But I kind of wanted to talk through a couple of questions just to kind of evaluate for yourself, like self-evaluation, if this is even for me. So, in a medical laboratory, you're going to be working with the same people every day, right? Um, you don't work with a lot of patients. There's not a ton of patient interaction, but depending on the lab, you might actually get quite a bit of patient interaction. But for the most part, you'll be working with the same group of people every day. Do you like having specialized tasks? Some labs will put you in chemistry, and that's where you are for the bulk of your career there. Some labs have you as a generalist, and you will work in every position and get experience everywhere. Personally, I prefer that because it's more diverse in the things that I do in a day, and it makes the day a little more interesting. And then this bottom one I think is important. Do you want to help sick people without dealing with sick people? It is draining to work with people who are at their worst all day, every day, who are sick and trying to get better and not finding solutions and just are really depressed. It takes a lot out of you. And those people who can work like that are heroes for sure. And it took a lot out of me to do that. And so I want to help people, but I don't want to directly work with them all the time. And so the laboratory just fit perfectly for that. So if this is you, then this is right for you, kind of a thing. And don't do it off of that one question, obviously. Do your research. Here's the assessment. I'm going to jump into this real quick. It's embedded on their website. You'll fill out these questions, and then at the bottom, get my score. Once you click that, your score will show up at the top here. And as you scroll down, if your score fits in this range, you click on this bar and it'll give you kind of a detail of how you fit in, that obviously you're a good candidate if it's a high score. But if you get lower scores, there may be reasons why it's not such a good fit, right? Um, and it may encourage you to look in other places for a career. And so I like the way that they did that. There are other websites. MedCerts is one that did an assessment. I think you have to create an account in order to take the assessment first, but there are other assessments out there that you can look at, and they're very helpful in determining if this is right for you. All right. If you want to learn more about becoming a med tech, these are three websites specifically that I found with a lot of great information. I've obviously pulled from Lab Techify a few times, but the BLS website is a great place. This link directly, clinical laboratory technologist, that is synonymous with medical laboratory technologist. This is a great site, has a lot of great information. Learn.org also breaks it down pretty good and gives a lot of details there. Um, but that's the intro. And so I hope you've learned something. I hope it's opened your paths, I guess, to to have more options. And I hope that this was valuable to you. And I appreciate your time. Thank you.